G'day, I'm Tim Wilson, the federal member for Goldstein. I know, like many of you, we're living through difficult and challenging times, and one of the most important things for all of us is that we take care of our mental health and well-being during this difficult crisis. Mindful of the challenges everybody's facing with the current circumstances, we've brought together an expert panel who can give us some guidance and advice about how they're helping and supporting others to take care of their mental health, and to make sure that you have the best tips and strategies to reach out and get assistance or support and take care of yourself during this difficult time. We're incredibly privileged to have three experts who are able to offer their insight and their advice. We have Jane Laidlaw, the Centre Manager at Headspace in Elstonwick and Bentley. We have Emma Halpin, who's the Clinical Psychologist and Senior Clinician for Headspace Early Psychosis Program in Dandenong. And we have Peter Pamutskas, who's the Headspace Youth Advisory Committee member and focus group facilitator. Thank you all for being with us today. To all three of you, just before we go into some questions, I just want to ask you how you're managing this current crisis. I know myself, none of us are immune to the challenges of being at home for long periods of time. In many cases, people aren't able to go to work in the way they normally used to, and certainly seeing their friends. I found myself sometimes being down, and have done simple things like making sure that I exercise regularly, manage what I eat and drink, in particular alcohol consumption, and making sure I'm in touch with friends, whether it's through Zoom or other social media platforms, so I don't feel isolated and alone. How do you manage this time yourself to make sure you're taking care of your mental health and well-being? Peter. We can't get audio from you, Peter.
Okay, we all good?
Go.
I think for me, one of the most important ones is still keeping in touch with my friends. Obviously, we're restricted in how we can do that physically, but utilizing technologies such as Teams or Zoom to still make sure I'm catching up with them and having chats and talking through a lot of what's going on, but also still making that social space.
Cool. Emma?
I agree with Peter. I think it's about connecting to my important people in my life, but also maintaining that routine. I'm lucky I'm still going to work, but it's really important for me to remember, as you were saying, Tim, eat well, sleep, and make time for things that I really enjoy doing, exercise regularly, and it's the boring stuff, right? But it's the important stuff, keeping that routine.
And what about you, Jane?
Well, I was very lucky that the yoga studio I go to got an online class going very quickly. So it's live, so it still motivates me to go. So that's great. And I find having structure around other things like there's a Deepak Chopra meditation that you can do every day that only goes for like 10 minutes. I just find that really helps kind of kick my day off. And like the others said, keeping contact with people is really, really important as well for me.
One of the things we know is that this crisis is having a particularly disproportionate impact on young people because of the impact on their family life, their work, their academic studies at school or at university. Why do young people contact the Headspace Centre, and what types of things are they experiencing?
Well, people can contact for a whole range of things, but for young people, Headspace, we see people 12 to 25. So it can be small things that they present for. It can be quite a major thing. So it can be really dealing with school and study, and obviously with COVID, that's put on additional stresses for people of having to do remote learning. Relationships is obviously a huge one for young people. They're just getting out in the world and starting to form relationships, having their first intimate relationships. That can bring a lot of challenges and, the full range of emotions. It can be struggles with their identity, trying to find their place in the world and really where they fit. So it can be all those things. It can be, unfortunately, people having had trauma either in the past that they're then needing to process or current trauma. So it can present in people starting to notice that they feel more anxious. They might get a bit flat, feel down, even, depressed. As you said earlier, it can be really those changes in sleeping, eating, exercise, so not wanting to reach out to people, withdrawing. So they're all things that we notice that people come to Headspace for.
Mm-hmm. And just to add to that, I form part of the specialist early psychosis service. So in our service, we see young people who experience psychosis, or it might be at risk of experiencing psychosis. And it's a really broad term to refer to some unusual experiences that people have. So they might hear voices or see things that other people can't see, or have some changes in their thinking, or might have a family member who's had those experiences and worried about having those themselves.
So what are some of the things young people are experiencing in relation to their mental health specifically and well-being generally during COVID-19?
I think being well into lockdown 2.0, it brings on a lot of pre-existing feelings that we had previously, but also some new experiences. Certainly, there's a lot of anxiety surrounding being by yourself and not being able to see your friends, being isolated. And it's also, as a young person, as Jane said earlier, we are trying to, I guess, find our place in the world and know what we want to do and things like that. But at the moment, we aren't able to do that as much as we could because we're at home. There's also the anxiety around job security. A lot of us have casual or part-time jobs, and obviously at the moment there is a lot of stress surrounding that. And again, things like uni, there's a lot of change, and it can be difficult to adapt to that change so suddenly, and it's bringing a lot of feelings of anxiety and stress for young people.
Mm. Yeah, I think you made some good points there, Peter, around disruption to people's routines. Things have really changed, right? Changes to work, school, study, everything. Life in general is gone completely, well, it's changed completely. We're definitely finding some people are drinking more alcohol, using more substances, and dealing with that, I suppose, in the centre. I think the major challenge that I'm coming across is that those feelings of loneliness and isolation, disconnection. As Peter said before, young people, and Jane mentioned too, it's about finding ourselves, and we do that through relationships. And when we're disconnected and isolated from people, it makes it so much more difficult to do that.
I think you touched on a really important. Sorry.
No, go for it.
I think you touched on a really important point, which is it's the difference between the norm and today. So what does good mental health and well-being look like ordinarily?
I always think about 4 main points. They're really, really broad. The first one is enjoyment of life, and that looks really different for everyone, right? What I enjoy about my life is really different to what you would. It's also about our ability to cope with stresses and bounce back from those, bounce back from sadness that we will all experience. The third point is the ability to set goals and fulfill those goals. So whether that's relating to work or study or travel or whatever that might be. And the fourth point is the capacity to build and maintain relationships. I was talking about feelings of loneliness and isolation before. And it's sort of the antidote to that is to connect and to be with people.
I think personally looking at mental well-being and it's for me, it's looking inside and looking at my behaviors, bit large or small. Emma talked about goal setting, and for me, one thing can be waking up and making my bed or making sure I'm eating 2 or 3 meals a day. And if I see that behavior start to change, or if I see there's it's a lot more energy to do those tasks, that's when I can start to see the difference in the level of my mental well-being.
I think that point around goal setting is really important because a lot of days at the moment feel like they fade into each other. Sometimes it's not even clear where the divide between weekdays and weekends sometimes appears. So what can young people do to take care of their mental health and their well-being in these difficult times?
Yeah, as you say, it's a really challenging time. So as people know, we are a Headspace Centre, Elstonwick and Bentley, but we are part of a national Headspace strategy, and there's actually a national office that has a lot of great resources that we'd also really encourage people to have a look at. And one of their main great resource areas at the moment is this seven tips for a healthy headspace. I know you can't really see that, but it's on their website, and I'll just talk you through some of them because they're just, you know, they are really simple things that we kind of know, but to spend some time really getting a bit of a plan for yourself is really important. And as Emma said before, it's finding the things that make you feel good, and that can be different for everybody. I heard a great story the other day of, you know, someone providing some telehealth to a young person, and they were feeling pretty flat. And the young person said, you know, I'm going to play you the song I just wrote on my ukulele. And that just, you know, shifted the whole thing. The ukulele came out, she played it, beautiful song she'd written, and you know, that's what brings her joy, you know. So it is just really turning to those things that make your own heart sing, really. And it doesn't have to be for long. They might be just little things you do each day. Another really great strategy they talk about is learning skills for tough times. So this is where we all have to practice things. You know, the first time you do things doesn't necessarily feel that right, you know, that comfortable. So you just got to try some new things. And it, you know, it might be trying the online meditation or yoga, or, you know, ringing someone you wouldn't usually ring and reaching out just to make that contact. So it's having some of those things that you can turn to in tough times. As we've all mentioned, creating connections. So really identifying who are your go-to people. And it can actually be really good to have a few people named that you've kind of got a little bit of a contract with, that you might ring when you're not feeling so great, that you can reach out to, and vice versa. You can offer that up as well. So, and then eating well, as Peter mentioned, you know, noticing if your eating goes a bit off, and then really that bit of discipline that each day you'll make sure you're still having your 3 meals a day. Staying active, you know, the going for the walk, the, you know, doing whatever keeps you active, getting enough sleep. And I think, as we all talked about, you know, people can really turn to drug and alcohol at these times with, you know, it's a great way to kind of cover up how you're feeling sometimes, or get you out of that bad funk. But then, as we all know, the repercussions later can be not so great. So we're really, the last tip is to really look at how you can, you know, monitor and keep your drug and alcohol use down as best as possible. So, yeah.
I think in my experience, when it comes to looking after my well-being and looking at self-care for mental health, for me, it was understanding that things work differently for different people. So, for example, one of the 7 tips that Jane spoke about was getting enough sleep, and for me, that was one of the tips that I needed to do a lot more work on, because it was something I wasn't doing and it was affecting me in my life. And then it came to self-care and realizing what worked for me, and what worked for me in terms of what are things I can lean back on in the long term. So for me, it was reading or using bath salts when I have a bath. And, you know, I can understand that I can read for the rest of my life. It will always be a resource there for me, and it's something that I can easily access and pick up. And yeah, there's not less barriers to using it and helping myself.
I think, just to add to your points, Peter and Jane, reaching out for support if you need it. Obviously, we're from Headspace, so we recommend Headspace, but it's reaching out to friends and family, as you know, GPs or whoever it is around you.
And I think that's one of the key topics you've all touched on, is that you need support structures which often involve other people, and it's not a one-way street. You can be as much a support mechanism to somebody else in the process that they're supporting you. How important are family and friends in a young person's road for good mental health and well-being at this time?
Well, I think you've answered your own question there, Tim, and we've been talking about it a fair bit. Very important. I think at Headspace, we encourage family and friends to come in to as many appointments as they like, and especially the first appointment. We really encourage what we call a young person's network, because we recognise that sometimes people aren't as connected to their family. Perhaps they're more connected to their friends or other supports in their life. And we really encourage anyone who is important in a young person's life to come into those appointments as well. And we also acknowledge that for some people, they don't have that network yet, and then maybe they want that network. And a brilliant part of our service, I think, is that we have youth peer support workers and family peer support workers who can sort of jump in and support a young person in the room with clinicians. They provide a lived experience. So youth peer support workers are young people who've had similar mental health challenges, recovered from those challenges, and are now working for us, or providing that support in a different way. So really providing a different perspective to a clinician like myself. And the same with the family peer support workers. So they've had family members or children usually who have recovered from mental health difficulties, and again have that different perspective of what it's like to be a parent who's had a young person struggle.
Yeah, I definitely agree that family is important in a road to good mental health and well-being. I think it's also important to recognize that you can get different support, different types of support from different people. I think for me, early on in schooling, family was very important, not just in mental health, but in developing into who I am today and the nurturing kind of atmosphere I got from family. But then also recognizing that I lean a lot on my friends for support in social aspects and talking about other aspects of life in uni and what I get from them as well.
Yeah, and that's not just that's a thing for everybody. I know I do exactly the same thing. Whether it's simple phone call or some form of connection, it's critically important, even as a member of parliament, to do that because we're often distant. We're distant like everybody else from the people that we normally rely and support on. And you talked, Emma, particularly about the options there are if you don't have somebody to rely on for support to be able to go into a headspace centre. What services are also on offer at a headspace centre?
Yeah, look, we have a range of services, obviously. So the Headspace Centre at Elstonwick and Bentley, and is the same all around Australia, has a range of GPs. So we try and have a youth-friendly GP presence, and they will deal with sexual health issues, physical health issues, relationship issues. So that has that youth-specific approach. And then we have a range of people providing counselling. So we have psychologists, OT, social workers, all mental health clinicians that will provide one-on-one sessions for young people, and they are provided through a mental health care plan. So people are able to get up to 10 sessions on a mental health care plan. We also have art therapy here and family therapy, which is great. We have what's called single session family work available, which is sometimes a lot of families come once and then don't come back because it can just be enough to really get that family dynamic moving and talking around a young person, and we find that's really effective. So that's also a great thing we offer.
I'm works primarily with the volunteering service, so I'm part of the youth advisory committee at Headspace Bentley. And what that is, it's I guess like-minded young people coming together to work with the employees of the service, and we're really empowered to engage and use our youth perspective in how the service is run, but also going out into the community and being advocates for what we're passionate about and doing a lot of good work around that. I'm also a peer volunteer, so part of the youth early psychosis program. We run different types of groups, a broad range of groups for people to come and use those services. And then we're also active on social media, so we can do engagements for events and stuff like that.
As I mentioned earlier, I'm part of the specialist early psychosis service. So we have 4 sites across Victoria, and 2 of them, so Bentley, Narre Dandenong and Frankston. And we provide more of a holistic care. So we do definitely focus on mental health, but we also have recovery and discovery colleges around the young person. So focusing on physical health, on life skills, on, as Peter mentioned, group programs, and then a focus on career and work, study goals, and peer support, and then also the medical side of things. So.
I can imagine for a lot of young people who may feel like they need some support or assistance, first there's the challenge of saying I might need, acknowledging that you may need some assistance, but then it can be, I don't know, a bit scary, a bit intimidating to engage. How would a young person contact Headspace?
You make a really important point there, Tim, because I think what happens is, people will be struggling for quite a while with something before they reach out, especially that first time, for a bit of support. So we do find it's quite a delicate time that we, really need to make sure when someone does make contact that we really are open and contact them back pretty quickly. Most people would contact us via phone, and it can either be a young person referring themselves, might often be, a concerned friend or family member, the schools as well. Obviously, all of the schools have a wellbeing team, and so they'll have young people that they're seeing frequently that they might feel need a little bit more support than they're able to offer in the school system, and that'll be a referral point. We do also, if people walk in, we'll obviously try and see them straight away and have a clinician or someone that can engage and talk with them. And GPs is another way that we get a lot of referrals. So we might actually sometimes even just get a mental health care plan faxed through from a GP that then we follow up from that point as well. Well, the other thing actually probably to talk about is telehealth. So because of the with the COVID restrictions, we very quickly had to move to a telehealth model, and it's something that has been talked about in the field for a very long time, at least a decade, and there's been a lot of resistance from both sides, really, from clinicians and from people receiving services. But yeah, so this really has been a bit of a kickstart in that area. And Headspace, we were very quick to adapt that technology, and luckily Alfred Health was able to support that as our lead agency with the IT capability. But within the first couple of weeks, we were up to providing 250 individual sessions by telehealth, or if the telehealth, some people still didn't really like the screen, telephone, people found was just as effective. So yeah.
So how much does the service cost?
So the Headspace model is that the service is either free or at a very low cost. So really, most of our services are all provided free, especially all the early psychosis program services, the group programs, Discovery College is all free. The mental health care plan sessions provided through counsellors, they are paid through GP, like when you go to see a GP, through the Medicare payment system. And if people are able to afford it, if they are seeing a clinician more than those 10 times, they'll pay that same Medicare rate, or they may be up to $35 out of pocket above that rate. But that would be the maximum.
One of the critical things is that cost shouldn't be a barrier to you accessing Headspace services, getting support and assistance, and then we go from there.
Cost would never be a barrier. If people can't afford to pay, there would be absolutely no payment. Yes.
So what I think we're talking about Headspace and what it does and a critical role that it can play in providing support. But of course, it's not in isolation. It works with a lot of other community organisations to support young people challenging with mental health and wellbeing issues. What other organisations does it work with?
So Headspace centres are located in lots of different areas, and as such, the demographics of each community differ really significantly. And I think the brilliance of Headspace is that we adapt with that. Broadly speaking, Headspace is linked in with drug and alcohol services, things like Centrelink, NDIS, vocational supports, housing or homelessness supports, refugee and asylum seeker supports, and then hospital networks. As Jane mentioned, we're part of Alfred Health, but we also liaise with other hospital networks and GPs, schools and TAFEs, and anything that young people might be involved in, we want to get involved in as well. Because it is.
So if other areas are creating mental health challenges because of concern or stress or anxiety, you're able to connect them into those services to help manage those situations?
Yes, yeah, and perhaps even invite that service to a meeting with us so we can all be on the same page.
And we also have some other great partnerships going in our area too, and this would be true of all Headspaces. We've got a great partnership with St Kilda Football Club because they're at Moorabbin, which is close to us, and they've got a beautiful new facility down there. So we run programs down there and get to use their great facilities, and we're looking also at being quite involved in their development with their wellbeing centre they're developing. We work with a lot of the TAFEs on some great projects as well, and we're looking at work with Cricket Australia too. So that then creates new opportunities for our young people as well, which is great.
And you don't have to support St Kilda to be a participant in that.
Of course, we support St Kilda when we're there.
Peter, do you have something?
Yeah, so Headspace works with a lot of schools. That's actually how I first, I guess, engaged with Headspace. They came into my school at year 7. It's where a lot of my mental health education came from. And what was really good about it is that it wasn't a once-off visit. It was continuous engagement up until year 12. I guess as part of my volunteering role in the Youth Advisory Committee, we work with a lot of, I guess, local community organisations. The Jallis Craig Foundation, we've recently started working with a few environmental organizations, but also those more broader spectrums. I mean, we attend the Pride March and the St Kilda Festival, so a lot of community organizations we engage with, definitely.
I've seen you at Pride March. Now, what support would you give a young person experiencing mental health challenges?
I think a lot of my support comes from what I've learned from my personal experiences, and I know I've touched on a lot in this, I guess, this session, that it's just finding what works for you. For me, it was trying things, and I guess the challenge was not being disheartened when they didn't work. But when I did find those things, it was putting them into my, I guess, self-care plan and making sure I could use them throughout my daily life, I guess.
Yeah, I suppose for me, it would be just in terms of general kind of thinking and advice is really, especially at this time, is really thinking about when, as a young person or anybody in our community, actually, when you're feeling okay and you've got a bit of space to reach out to other people, to, reach out to people, your friends, other people that might need a bit of support at that time. Because I think we also get quite a lot back from that. But I think also very important that when you're not feeling so great in yourself, that you do reach out, because I think that's a harder time for people to reach out. So really developing some strategies around when you're not feeling okay, to really find some ways and to have some people lined up that you do reach out to.
Mm. I suppose for me, I can't really answer that without having my clinician hat on. So I suppose I would invite a young person into my therapy room, which I'm currently in, and we would start from there.
Well, all that's fantastic advice, and I think hopefully destigmatizes any concerns young people have around mental health challenges. We know people are doing it tough at the moment because of all the reasons we've outlined. People facing peer challenges, obviously isolation, maybe not having the full support they're used to, and of course being separated from the environments like university or school, or just spending time with their friends at the local footy club or netball club or any type of winter sport, and hopefully it ends there. So we just wanted to thank you so much for coming and helping and sharing your experiences and knowledge about how young local residents can help manage their mental health challenges, and to make sure that they understand they're not alone, that there are important support mechanisms like Headspace with the wonderful people we've had, Jane, Emma and Peter, on this session. And to thank you for your participation, Emma, Jane and Peter, and insights, because I think it'll help a lot of local young people understand how they can get the assistance and the support that they need.
Thanks, Tim.
Thank you, Tim.